Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hey, this is Nurse Paula. Welcome back to It's a Young Thing. And you know what? Today we're going to be talking about spots. I talk to people all the time. I'm an aesthetic nurse. I talk to people all the time. The one thing I notice about people sometimes, and it's kind of weird, I find myself, my eye just drawing over to that, is most people that I know have some sort of a brown spot on the left side of their face. Well, in the United States anyways. It's very common. And then I look at their left arm, and I see freckles and I see spots in their left arm. It's like, most people don't notice these types of things, but when you're in my business, you pretty much see everything. So guess what that is from? Yep, believe it or not, it's from driving a car. When the side of your face and your side of your arm, whichever's on the driver's side of your vehicle, whether you're in the UK or in the United States, you get these sunspots from constantly being in the sun, especially if you drive a lot. Now, I'm not talking about melasma. And if you have melasma, you know what that is. It's a pretty deep hyperpigmentation situation or condition that we can talk about that in a later episode. It's a lot more detailed than a sunspot. But sunspots is what we're talking about. And you know what? They're really easily treated. And there's a laser called IPL. You might hear it abbreviated that way. It stands for intense pulse light. Now, not everybody can undergo all laser treatments, especially IPL. IPL is like a flash lamp laser, and people of darker skin types cannot be treated with IPL, with an intense pulse light. So we'll get to that in a little bit later. But just so you know, it is a great treatment for not only clearing out these sunspots and grabbing that melanin that's under the skin and bringing it to the surface, but it's also really good at cauterizing those little tiny broken blood vessels on your nose that we call telangiectasias, and also lifting up a little bit of freckles. It makes the skin really smooth. And you can do, we call them IPL Photo Facials. You can do them pretty much anywhere you've got this sunspot pigmentation. Your décolleté, the tops of your hands, anywhere you have these brown spots that kind of makes you a little bit older or a little bit more worn. So, like I said, with IPL, you really want to make sure when you go through your consultation with your aesthetic provider that you do get skin typed. You need to know what your typing is, and we'll talk about that topic also in a future episode. But you need to know your number. That's basically it. What is your skin typing number? And like I said, people with darker skin types don't even think about IPL to get rid of sunspots. There are other laser modalities that are a lot safer than intense pulse light to relieve you of these darker sunspots. So thank you so much for joining me today. That's pretty much all I have about sunspots. It's pretty easy. I'll just tell you a little bit about the treatment. You just, the laser will hit the spot, brings the pigment up to the top. The pigment gets really dark. Expect these spots to get dark. And after about a week, they pretty much just slough off. So, prepare for that. The spot gets really dark. You want to make sure you have some concealer. Definitely don't do this a day or a week even before an event. You want to give it time to come to the surface of your skin and fall off, or, you can take it off with a little bit of a microdermabrasion. Gets all those spots off real nice. So that's it for clearer skin. Think about IPL Photo Facials. Make sure you go through a consultation with your aesthetic provider to see if you're a candidate for this laser therapy. And that's all I have for today. I'm Nurse Paula. Thanks for joining me today on It's a Young Thing. Make sure you subscribe to my podcast on iTunes. That way you're not going to miss any episodes when they're released. And they're also available on SoundCloud and our website at youngmedicalspa.com. We'll see you next time.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittman social media creation. Steve Mittman, socialmedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.